Okay, so I'm Dr. Alan Nasypany. I'm an athletic trainer, and I've been practicing PRRT for quite a long time now. And from my point of view, PRRT basically changed my practice. And I had done a few things beforehand that were impactful, and they helped people and challenged a lot of beliefs, but I never did anything that was so fast. And so we were talking off camera for a second, but the idea of what would you say the biggest contribution of PRRT to patient care or to client care, or however you want to phrase that, what would you say the biggest contribution is?
Well, I think it's my my sense that in order to make major changes and lasting changes in the body when there's symptoms, maybe pain, maybe just restriction of motion, or both. So what PRRT makes a difference is that there's usually a change noticed within the first few minutes of treatment, and that release is usually maintained from one visit to the next visit, and sometimes there's no need for a second visit. The results are so significant and dramatic that the body just adjusts to this new normal of being able to have motion without symptoms, whereas before there was limited motion because there were symptoms associated with trying to move in a certain direction. So I think what PRRT's done has changed that dimension to expecting to see changes immediately unless the pathology is significant, whereby maybe nothing is going to make a major difference. Do you have a sense about that?
Yeah, I also think that even in case of major pathologies, we can make a big difference, and we might have to figure out a way to have them have a maintenance plan at home that they can do.
Right.
But it could still be life-changing, especially if they're not going to get surgery or if they've been through all the surgeries. I also think that when I learned about PRRT, because if I look around at PT clinics still today, this is in 2025, most are still modalities based, exercise based, and when you fail with exercise, you know in 6 to 8 weeks or whenever the insurance runs out, you know? It's like very slow and you don't know, and there's a lot of faith that this is the path, but there's not a lot of confirmation along that path. And when I found PRRT, it was like instantaneous test, retest. Worked, didn't work. Okay, if it worked, do we need to do more or do we move on? And we were just playing with test, retest the entire time. And I feel like the other thing that I really learned from that PRRT opened my eyes about is that the driver, the nervous system driver, is often in a place they're not complaining about. And that was an eye-opener for me. You know, because a lot of people come with a shoulder issue, and let's say they've seen 4 practitioners, everybody's looked at the shoulder. And even if they're so-so, they'll probably figure it out if it's really a shoulder issue. But the people that are having recurring symptoms or more pain or more dysfunction, seems like understanding that it could be coming from less known places was a big eye-opener for me. The role of dural drivers, the dura being not just protective but highly sensitive. The autonomic nervous system balance, I learned about autonomics, not from a treatment standpoint. I learned about the reciprocal innervation, but I learned it as reciprocal inhibition, but I'll never forget that, reciprocal innervation. But I had no idea that what to do with that. We had to learn it, and it made sense, but it didn't. What are you going to do with that? And then I find you that has figured out 1,000 different ways to use that to help restore normal function and decrease pain. So I think all of that for me is like groundbreaking, once in a generation stuff. So can you speak to how you had obviously been practicing for a while. You saw a lot of really tough to see things working with the military and the Navy, right?
Yeah.
And I know personally that what drives me is not being able to help somebody, right? And so can you tell me how you got, why you got started on the path, and then were you always that creative, or did that come out of necessity?
Yeah, I wouldn't say I was always creative. I was always struggling to figure out what was needed for each patient. And what made a huge change for me was being a physical therapist, seeing the servicemen coming back with injuries that were horrendous, and the types of injuries you would never see normally. And many of the injuries they had were not something that even PRRT could make a difference for, but yet many times we were able to make changes where the assumption was there that you can't do anything more to make a difference for them other than just pain medication, which really isn't a solution. It's just it's a Band-Aid on the dike, so to speak. And by testing the nervous system the way we do with PRRT, I was able to help injured servicemen in ways that no one else had ever figured out how to do. Even today, when I talk to orthopedic surgeons, when we have patients that are referred to us, they don't seem to have the appreciation about reflexes that we do. And so they're typically not examining reflexes the way we do, and they're not using the reflex systems in the body to be able to reboot out of pain, because I really think it's a reboot that we've figured out. And fortunately, once we've rebooted out of pain, oftentimes it's a lasting benefit. Sometimes it takes a number of sessions to make a huge improvement or a lasting improvement. But the veterans that I've treated, and I still do treat the veterans, they are so appreciative because they've never had anything like this available to them, and they just can't believe how dramatic it is to be able to do a few things, to be able to take reflexes and be able to have them move in ways they haven't been able to move, and to not have pain associated with movement. They've just said, why didn't somebody know about this before? How is it that, I had to have gone all this time period and didn't get the kind of help I really needed? And it was hard for me to answer them because I knew that they were really stressed by feeling that this is the way it would be the rest of their life.
Yeah.
And we're able to make changes for them that they don't feel that same way now. And when I see the servicemen now in the community and we run across each other, they'll come over and hug me and thank me. I'd never had that experience before PRRT. And it was very rewarding to know that, what I was able to come up with could change their life. The servicemen during Vietnam, when my wife and I were back in New York and we were trying to be helpful to the veterans. I mean, they were so dysfunctional that they would, stand there, look at the wall, and urinate on the wall as people were walking by down the hallway. And we'd never seen anything like that before. And it was tragic to see it because it said they did not understand what was appropriate behavior because of the damage to the nervous system. And so that pushed me to do more research to try to figure out what we could do for them, to do more for them. And a number of things that I came up with are still in operation today. And I've been told by the different branches of the service that I've dealt with that they felt that what we offered was something that was just tremendous compared to what they had available before.
Yeah, boy, there's a lot to unpack in that. I had goosebumps for about half of that as well, because it's why you're here, right? It's the mission. It's part of the, the reason for being on Earth is to help. Mm-hmm. And speaking of it as a practitioner and a friend, and we're all so grateful for that. And a lot of times it comes in some of your darkest moments too, when you're realizing like it's hard. And I always say I work in a clinic and I work with my students, and the best thing that we learn in the clinic is that it's hard to treat patients. Mm-hmm. And almost never does everything go right.
Yeah.
And so, but we explore together, and that, some of the things that I got from you was paying attention to the details. A 1903 textbook that everybody had, because when people write a textbook, they really just edit textbooks at this point, especially anatomy ones. And realizing that, well, just because it wasn't commonly known doesn't mean that it's not true. But what they do is they take the most commonly accepted thing and then they merge it all together and then they push it forward. And I've actually seen people writing textbooks, anatomy textbooks. But the thing is, if you had somebody who really knew, but it was uncommon knowledge, a lot of times that doesn't make it forward. Mm-hmm. So having somebody to look back at those things and just be curious enough to read and reread, and all of a sudden you see something, you're like, wait a second, I've never seen that before, or I've never thought of that before. So I think that, for me, it all starts with curiosity. And you're talking about, it's a hard question to answer, why other therapists haven't helped them, or other healthcare practitioners. And I think we're at a time where it's all in front of us. Like, we could know basically whatever we want to know at this point. Mm-hmm.
But we have to be open to that.
But we have to be, it's all curiosity.
We have to accept the fact that we haven't known that in the past, and we now have the opportunity to know that, and to implement that in our treatment plan.
And I'll say, from our conversations, we talk about one thing, and what it does for months and sometimes years is it always gets me spinning more, in a good way, like just looking for more things, or sometimes some of the techniques I try to figure out how you came up with them. But it makes me always go, okay, well, there's what we're seeing, but there's always layers and layers that we're not seeing, that all of a sudden, if you're paying attention, there's a Louis Pasteur quote that says something like, in the fields of observation, chance only favors the prepared. Mm. Or, in other words, the more I practice, the luckier I get, right? The more I pay attention, the luckier I get. So I think you've made a career of paying attention, being outside the box, serving people, exploring, teaching. Even in seminars, people come into seminars and they're getting treated. We had a whole group of people that came in and just watching the effect that somebody can have in seminars. It's just coming in and getting treatment and learning a whole new way to treat people, whether you've been practicing for 5 years or 100 years, right? It's like, it can all be different. So, do you have any other thoughts about like a takeaway for somebody? Practitioner, let's go practitioner end. Is there anything that you would encourage them to do to maybe start their journey?
Well, I think it depends on whether a practitioner is satisfied with their knowledge and the results they're getting with the patients they're treating, or do they feel that there's something missing in their repertoire when they're examining, get the history, examination, and treatment, and if they're sensing that the patient isn't responding dramatically to their treatment, then I think they really need to take a look at what we're offering with PRRT, because there's really nothing more primal than the nervous system, and reflexes are at the basis of most of the nervous system, especially the autonomic nervous system. And I mean, we've had gurus in the medical profession who have had dramatic impact, and unfortunately that hasn't been able to be spread worldwide like it should be, to be able to have people have the advantage of being treated with this approach. Because if PRRT is going to be someone's answer on the very first session, there will be changes. There'll be some sense of change, even if in the past they haven't responded to other approaches from other practitioners. But with PRRT, it's almost always that on the very first session they have a response, and they're surprised by the change that occurs. And then the question is, okay, well then, does it last? You know, when they're back for treatment again, have they maintained the improvement they had, and have they even gone past that point? Because that's another sign of improvement.
Can I interrupt you for a second?
Yeah, go
on
ahead.
That?
Yeah.
We were talking in our seminar this weekend. I was giving them my rule of percentages, and I didn't come up with that. There's very few things I think I've ever come up with on my own. Right? You just listen to smart people, and then you pay attention, and then you see how it works. But rule of percentages: if they get 50% better, 50-50 shot that they continue to get better or they get worse from where you left them. If they get 70% better, probably a 70% chance that they're going to maintain or get better. If you get them to 80%, usually there's nearly 100% chance they remain or get better. So as we start getting to that threshold, and we were talking about, the goal for us a lot of times isn't 100% better, because we're actually trying to remember their nervous system, how to be empowered.
Yeah.
Right? So we take off the burden, we get it moving again, we start to get things together, and then we let their system, like, we don't want to be the saviors, right? But it might feel like that the first session, but we're really trying to help them dial themselves back in.
Mother Nature knows best.
Yeah. We can maybe like reroute them, but then we kind of let their system learn best and remember best.
Yep.
So I'd say last question. This could be a big one, but last question. Where do you see PRRT going? Like, obviously you've done your thing and you've taught hundreds upon hundreds of people how to do this and affected thousands of patients, and all of that is what it is. But where do you see PRRT going in the future?
Well, I think there'll be a continuation of realization of what we have with PRRT, and that more and more practitioners who have other types of trainings will sense that there's something missing in what they're offering their patients, and they'll be searching for something and they'll find PRRT, and then they'll realize this is one of the major missing pieces in the puzzle of pain that's not talked about and studied enough and applied enough. And I think that's what will continue to drive this, because for a practitioner to have a difficult patient and to see results on the first session will actually cause the practitioner to feel that they have done something that is extraordinary and that they couldn't have done if they didn't know PRRT and use it. And I think that will give them confidence to be able to help more people in less time and help more of them to be having lasting results, not just temporary improvement. I see that as the goal for the future with PRRT.
There's a Qigong master, his name's Chuni Lin, and he always says, a world without pain and a healer in every house, right? And I see, one of the things I see with PRRT is that maybe a lifetime to master, but the basics can be so simple. And the best techniques and the best treatments are generally simple and powerful, right? And I see people being able to use PRRT at home on their loved ones. Like it's commonplace. There'll be 20 years, 15 years that it's just common sense to use the opposite side of the body, or the opposite side, biceps and triceps, or to eliminate pain.
Yeah, there's a reason that reciprocal inhibition is built into our nervous system.
Yeah, for us to use it.
Yeah.
Yeah. So I think that it can be as big as that too, where it just becomes just second nature to people. Before you go, I just want to tell you a story about my first year treating patients with PRRT. And it wasn't actually me either. We had a clinic, and we had one of our doctoral students, Jennifer. She had gone with me to my first PRRT course out in Oregon with Mike. And we came back and we were treating people. We were working in the clinic, and we had taught our students at that time just the primals, like the basic primals, just see if we can settle down their nervous system, right? And so this guy came in the clinic, and his daughter was walking him in. And she was holding him by the belt, and he was shuffling in. And come to find out, he had been in a serious truck accident, got ejected from the truck, tried to catch himself because the truck was falling on top of him, found out he couldn't bench press a truck, tore all of his pecs, broke all of his ribs, most of his ribs, lost parts of his intestine, lost his spleen. This is 7 years later. He's shuffling into our clinic, can't put on his own pants, can't put on his own belt, nervous system's totally dysregulated. My doctoral student was busy with another patient, and our undergraduate student at the time said, what do you want me to do? And she said, well, why don't you just start with the primals? Because it's safe, it can make a big difference. Obviously, he's probably got some trauma. The student did eye reflexes and I think it was just eye reflexes. I think she did 2 different eye reflexes and then some that released the back of the head, but all eye reflexes. Oh, and the palmar reflex, we did that.
Mm-hmm.
And I wasn't even in the clinic, I was in my office. He said, "What did you do?" Right, and that's not how he talked, because he was really slow and just in a lot of pain. And the student said, "Nothing." Because like that sounded like a bad question. He said, "What did you do? My whole system's buzzing." And he gets up off the table, sits up. Now it took them 15 minutes to get him on the table and laying down. He sat up like a zombie, right? If you could imagine that. And he spun off the table like I saw you do the other day. And he bent over and grabbed his shoes while he was still on the table. He bent over. And everybody's like trying to catch him. Then he stood up and he sat down. He stood up and sat down. He put his shoes on. He took his shoe off. This went on for 20 minutes. He put his belt on. Took his belt off. Put his belt on. And his daughter's just in tears. And
Probably couldn't believe her eyes.
no, none of them could, right?
Yeah.
And the whole point was, he went out to the stairs. We had the steep staircase, and he's like, "Well, let me check the stairs, because that's the worst thing out of everything." He goes up the stairs. He gets halfway up the stairs, old concrete stairs in a really kind of steep stairway basement, and he's skipping stairs going up. He comes back down, and he's running down the stairs. And at that point, I had just gone over, and I couldn't figure out what the fuss is. My student called me to come over, and I said, "Well, maybe you should hold the railing, at least coming down the stairs." And it was the most remarkable thing I had ever seen. We got the post of him putting on his shoes, taking off his shoes, putting on his belt, and if we had only known that that was possible, we would have had the best pre-video, but we had the post video, and we had an interview with him at one point. And anyway, it was the most remarkable thing I'd ever seen. The amazing thing is that 85% of that lasted. I mean, I've known him for 15 years now, probably. But amazing story of the power of the primal reflexes. And now that's the most amazing story I think I have with, but what do you want? I mean, that's a pretty good one. And so I think for a lot of people, I'd just like to thank you for all that you've done and created, and your life's work and your life's mission, and it's, you know, it's left an impact, and it continues to leave an impact. So I just want to say thank you, and, you know, show you our appreciation.
Well, thank you. Yeah. Yeah, I look forward to trying to do more, and with people like you that have studied the work and are using it, and I know that it's going to be around, because at 80 I won't always be around.
The science gets really good.
Yeah.
But imagine 3 eye treatments that took a total of 20 seconds. Changed a person's life. Administered by a person who probably learned that 5 days before that. Amazing, right? So I think there's a lot of possible things that we're just on the edge of knowing at this point. Thank you.
Thank you.